Hi, this is Dr. Kyle Cassas with the Steadman Hawkins Clinic of the Carolinas. I'm going to talk today about sports injuries, appreciate you taking the time to watch this video. The issue that we often face in the office and on the field is injuries that happen, and most of these injuries are overuse injuries, and much of these can be prevented. And so, if you look at what the real problem is, you have a large number of children that are participating in organized sports, and each year we see a large number of injuries that present both to our office and to the hospital. And as you can see here, the numbers are just increasing every year. We've got 7.3 million high school students that participate in sports each year, and of those, we see really about 2 million injuries. When you look at the young athletes, some of the issues that we face really are that many of these are specializing early on in different sports or different positions, and so much of these injuries now that we see in adults are actually happening in children, and that has to do oftentimes with immature bone, insufficient rest, and poor training. And oftentimes there may be outside conditions that contribute to these injuries. But at least half, or overuse injuries will account for at least half of all sports injuries that we see in our young athletes in middle school and in high school. The problem that we will see is that this can be something that will also last into adulthood and increase their risk of future injuries. And so as you see, a child's history of injury really relates to risk factors for further injuries down the road, both during their youth and during adulthood. And so sometimes these injuries can lead to arthritis and other degenerative problems later on in life. And certainly if we can prevent those, we want to do that so folks can have a long, healthy, active lifestyle. Most kids that are starting in sports very young can often burn out. And that's one thing that we want to try to prevent is kids from dropping out of sports. And many kids that you'll see here, 70% of kids that do drop out, primarily related to they're not having fun anymore. There's a lot of pressures on them from their coaches, from their peers, and from their parents to perform. We see this really in all sports. There's not one that's necessarily more common than the other. Oftentimes kids will drop out because they're either dealing with an overuse injury or they've had other injuries that will cause them to stop playing. And if children stop exercising, then they lose all the benefits that we know are good for kids, such as reduced obesity, hypertension, just learning how to work as a team, and just the benefits of just exercises of their overall health. So what is an overuse injury? And I think it's good to define some of these things. Overuse is really just considered excessive or repeated use that results in injury to the musculoskeletal system, whether that's bone, muscle, or tendon. And why do we see these in young children, or why do we think that maybe these are happening more frequently or more commonly? And some of it just has to do with the volume of stress. Kids these days are playing many sports all year round and really have very little time to rest. And that's probably the biggest thing I see is they may have pain, they don't take time off to recover, and continue to play sports all year. And this is really important in the overhead athlete or the throwing athlete. But other things that contribute really are immature bone, meaning they're putting excessive stress on a bone that is still maturing. Their training sometimes is not either supervised or appropriate, and oftentimes they're specializing in one sport. And the problem there is just putting increased stress or increased demand on one specific body part. And again, the year-round participation is a big problem. So what can we do as physicians, coaches, parents, athletes? I think the first part is education, and that's why we put this video together, really is just to educate the public. And this is a series of slides that I've adapted really from a Stop Sport campaign that we'll talk more about here in a minute. But I would encourage you to go to their website, stopsportinjuries.org, for more information. We'll talk more about what's on that website. But just having a discussion with you as a parent or an athlete or other healthcare providers really is helpful. And so the preseason physical is an area where oftentimes we ask about previous injury because, as I mentioned earlier, that's a risk factor for further injury. Or are they still recovering from an ankle injury or knee injury that we need to rehab further? Warm up and cool down is certainly important. Encouraging proper strength training routine really for young athletes, pre-adolescent, it's really the supervision that's probably the most important. General tips that can often help with injuries are just nutrition in general, proper nutrition, proper rest, drinking enough water, especially when it's hot here in the south or southeast. That can often contribute to injury, the muscles dehydrated, or even just heat illness. Nutrition and performance we talk a lot about with our athletes, both at the high school level and college. Supervision I've mentioned, and then again just telling kids to talk with their athletic trainer, coach, or parent if they're having any pain. Usually pain is a signal of something else going on, and certainly it's okay to be a little bit sore, but if that soreness persists, then it's time to get that evaluated. Prevention strategies really are many. I mentioned education, but also working with local governing bodies, specifically baseball, youth baseball, Little League teams, to look at pitch count and number of innings pitched, and that's something that we're seeing a lot more emphasis on lately. It's important that kids have fun when they play sports. Not necessarily, certainly winning is nice, but making the sport that they're participating fun, making sure that we don't have kids specialize at too early of an age, meaning specifically pitchers. I like the athletes to play first base, play infield, not just throw overhead, all year round if we can help it. And then obviously early addressing of some of the injuries as they arise. Oftentimes when overhead athletes come in to see us, we're going to ask some questions about throwing mechanics, but it also could be an athlete such as a volleyball player. It may be a tennis player where the overhead motion can lead to injury, and the mechanics of that overhead motion are important. As it relates to baseball, we talk a lot about discouraging breaking pitches until after puberty. And an easy way to kind of remember that you'll hear about is basically if the child is not old enough to shave, then they're probably not old enough to throw a breaking pitch. It's because they have not reached maturity yet. So discouraging breaking pitches at an early age, showcases where there may be a radar gun, oftentimes is a time where an athlete may get injured, and then trying to get athletes to have a rest period, whether it's a month or 3 months each year, is certainly a good goal. These are some of the organizations that really have been working hard over the last few years about injury prevention. American Orthopedic Society for Sports Medicine, or AOSSM, the NATA, AMSSM, American Academy of Orthopedic Surgeons, there's pediatricians, family physicians, and physical therapists, all really kind of involved in trying to make our sports safer. As I mentioned, the Stop Sport Injury website is a great one. You can see this is a handout on hockey injuries, but they have really handouts on every sport, some videos as well. Again, mostly sport specific, that are addressed tailored towards parents, athletes, coaches, and healthcare providers. And so, again, encourage you, if this topic interests you or you have specific questions, to go ahead and look at those resources. And again, this just shows some other areas where on the website, which include blog and some service announcements and downloadable information. So for the future, I think the emphasis really over the next few years from what I do and from a sports medicine perspective is going to be how do we prevent ACL injuries, how do we prevent elbow injuries in throwers. There's always new surgical techniques looking at how to get athletes back quicker, less invasive techniques which allow for quicker recovery. But if we can certainly reduce these injuries, we want to do that. Just for the reasons I mentioned earlier about later on in life. So research is important, and these are areas that we're looking at every day. I put here together some other information or some other websites that you can look at. Again, stopsportinjuries.org is very good. Orthoinfo, nata.org. These all are sites that have good information for parents, coaches, and healthcare providers as relates to injuries in general and overuse injuries. So I would challenge you to step up to the plate. Let's all work together to stop sports injuries. Certainly talk to your physician or athletic trainer about ways, if you have questions or ways that you can be involved as a parent with your youth teams. Again, my name is Dr. Kyle Cassas. I work at the Steadman Hawkins Clinic in Greenville, South Carolina, and I appreciate your attention.